Welcome to Mayo Clinic Behind the Scenes in Surgical Services, a podcast for surgical healthcare staff. I am your host, Lynn Sari, Nursing Education Specialist Manager in Surgical Services at Mayo Clinic based out of Rochester, Minnesota. Mayo Clinic Behind the Scenes in Surgical Services podcast focuses on collaboration, innovation, and inclusivity within surgical services at Mayo Clinic.
Thank you, Lynn, for that introduction. My name is Amy Henderson, a nursing education specialist here at Mayo Clinic on Rochester campus, and I will be facilitating our episode today. We are joined today by Karen Welch and Jessica Sarmiento, both who are patient care assistants, also known as PCAs. Our episode today will focus on a day in the life of a PCA. Thank you to the both of you for joining us today. We will go ahead and get started with a couple of questions. Karen, if you'd like to take the first one, could you highlight the area you work in and a little bit about your job role in surgical services?
Yes, I work at surgical services at Methodist at hospital. My roles here are assisting the nurses, bringing down patients for surgery, returning them back up to their room after surgery. We will be doing clippings, trimming the hairs of the patients. We work different shifts. I don't know if you want me to get into that.
Sure, that would be great.
Yeah, so we work a 6, 6:30, and 9:30, a 12, and a 2 o'clock shift is our start times. And you will work a variety of them. You get your schedule for 8 weeks out, so you'll be prepared. There is some flexibility in that, meaning that other employees may switch shifts if you are needing it. We do a lot of walking, pushing of our patients. So be prepared to walk 5, 6, 7 miles in a day. But my experience is that it's not hard walking, so you're not walking super fast. And if you need assistance with, say, a patient has more equipment, there is options there to have other PCAs help you. Like I said before, we assist the nurses a lot, so I find that very educational. They are always there to help you if you are having a problem with a patient. They step right in and just help you a lot.
Thanks for sharing.
Yep.
Jessica, would you like to add a little bit about your job role in surgical services and what area you work in?
Yeah, I sure can. I work at St. Mary's Surgical Services. I work in adult and peds, pre and post-op. We help with castrum transports to MRI and CT. We bring patients down for surgery. We bring them back up. We even help bring them directly to the OR. We do a lot of miscellaneous runs too. We get to go bring equipment to like the paint shop, or if it needs, like our carts need fixing, we bring them downstairs. We help get patients prepped for surgery. We do hair clippings as well. We help get vital signs. We help get the patients dressed in their gowns, get them comfortable with the nurse before surgery. And then after surgery, we help the nurse settle the patients. We help empty drains, and then again, help with repositioning and then transport them back up to their room.
So it sounds like both of you do a lot of work on the front end and back end previous to surgery and at post-surgical. So,
oh yeah.
Yes.
Thank you. So Jessica, could you explain what certifications are required in order to become a PCA?
So I got my CNA certification back in 2011, and I started my CNA journey in the hospital in Austin, their Mayo Health System. So I got to transfer my CNA to St. Mary's because I had hospital experience. And I know that many of my colleagues as well had that same experience. So yeah, I just had my CNA, and I know other people have got their PCA license or certification, but yeah.
And Karen, could you explain the difference in how your role as a PCA is different in surgical services versus like an inpatient care unit?
I haven't worked in an inpatient care unit for years, but when I did, we did a lot of sitting with patients to help them just get through their days, maybe bathing them, walking up and down halls, stuff like that. Over here in surgical, you are the very first person that they're going to see for the day. So you will get to encounter them, find out where they're from, talk to them in that aspect, get them down the stairs. And that's one of the big differences. So yeah, we just encounter them in a briefer time.
So it sounds like in surgery, you meet the patient for their surgical encounter, you're able to take care of them briefly, and then send them off to the nursing inpatient care floor, where on the inpatient care floor, you would take care of the patient's like daily activities or daily care needs.
Yep.
So Jessica, what is your most favorite part of your job?
I think one of my favorite parts is being able to interact with multiple different patients a day. I like learning where they're all from. We have many different patients from many different areas. So that's one of my first questions that I ask is, oh, where are you from? I like seeing them and getting to meet them before and then also after surgery when they're waking up. Sometimes they'll like remember you. They'll be like, oh yeah, you helped take care of me before. And then holding their hands, sometimes they're scared, and just being there to simply hold their hand when they're waking up, because some patients, they don't react well to anesthesia, so they're waking up, and being there to hold their hand and help calm them down. And then just being an ear, because they're scared. They're scared before surgery, and letting them voice themselves and just let them talk, and yeah, just being an ear.
Sounds like you comfort your patients.
Yes.
Do you typically see the same patients post-operatively as you did pre-operatively, or is it a mix?
It's a mix. So some days I'll start out in pre-op, and then I'll get to go to post-op and then help recover. It's not often that I get to see the same patient, but in the evening shift, more or less, I will get to see the same patient, especially if I bring them down from the floor.
That's nice. You can build continuity of care.
Yes.
And Karen, what is the most rewarding aspect of your job?
It's like Jessica said, it's getting to know that patient when you bring them down. And if you happen to bring them back up, the thank yous that you get from those patients of the quality of care that they have received for the whole process of going through surgical, the light on their face just lights right up, and it makes them feel so much more comfortable. That is like the biggest reward that you get here, is just them saying thank you for being the Mayo Clinic employees that they expect and receive, is the courtesy that we give them, the time that we give them, if they need time to just, settle down and calm their nerves before surgeries. And then the quality of care that they get afterwards. It's that thank you.
That's nice. So they're very appreciative. Do you see patients sometimes repeatedly, do you feel?
We do. Yep.
That's nice that you can build that relationship with them.
Yep.
Jessica, what advice would you give people who are interested in pursuing a career path as a PCA?
You know what? I think a PCA is a great career. It's also a great stepping stone. Many of my colleagues have made this their career, and I love that because they get to go through the motions. I have colleagues that have been here for years, and they've get to see all the changes that have happened. And then some of us were here and we're going to school, and we just get to see what other roles do. So it kind of helps you in deciding your own career path. You get to see like what lab does, what x-ray does. You just get to see all these different roles. So I think being a PCA is a great place to start if you're unsure of where you want to go.
Sounds like you're part of a teamwork.
Oh yeah.
Sure. And Karen, what advice would you provide someone who is interested in pursuing a career as a PCA?
I'd like to just go off that there is a lot of growth. There is a lot of people here that want to see you succeed, and they they just want to make sure that you have all the equipment or education that you need to succeed. I'd like to add in here that at Methodist, we are not micromanaged. You are taught how to do your job. And if you have questions from there, please feel free to ask. But they teach us what to do, and we do it, and we're just trusted that that's what is going to happen. I also enjoy helping here with my coworkers. I do part of the training over here, and it's just that seeing the light bulb come on when one of the other PCAs that coming in, once they start feeling more comfortable, usually within a few days to a week, that they just go, okay, I got this. And they're comfortable and they start to relax in their job. So yeah, that's a big reward to have that smile come to their face.
So you're able to help with the orientation and work as a preceptor and guide new orientees.
Yep.
Great. That's nice. And finally, what are the 3 main takeaway points you would want our listeners to get out of this episode? Karen, would you like to go first?
I had that we're not micromanaged. You have the freedom then to do your job as you have been trained. The educational growth that is either just by on-the-job training, learning as you go, or that the managers and other educational staff here will help you grow in, and that it is a very rewarding job just to see that smile on the patient's face.
And Jessica, do you have anything to add?
Yeah, you know what? I would love to add that this job is very rewarding. The nurses are so appreciative of you getting to just be diverse within your job, like getting to do many different things. Like, I just think being a PCA is a great, great career.
Thank you. I would like to thank both Jessica and Karen for joining us today and for sharing their insights into a day in the life of a PCA on this episode of Mayo Clinic Behind the Scenes in Surgical Services.
Thank you for joining us for this episode of Mayo Clinic Behind the Scenes in Surgical Services. I hope you enjoyed learning more about this topic. We invite you to check back often for our latest podcast on the Mayo Clinic YouTube channel by searching Behind the Scenes in Surgical Services podcast. Please share your thoughts, questions, or suggestions via email at dlrstsspodcast@mayo.edu and reference this episode. Until next time, have a great day.